It is very special work that is being done by JAPIGO South Africa, specifically in their HIV counseling and testing program, commonly known as Siyazi.
Siyazi means know your status, and it's one of the words that we chose as we were opening this program 5 years ago.
JAPIGO South Africa is a not-for-profit company. We've been operating in South Africa since 1995, and JAPIGO has been registered as a local entity in 2007. We are affiliated to JAPIGO Corporation in the US.
Siyazi is a prevention intervention as part of the HIV TB intervention. And as part of the intervention, we are responding to the government's call for civic action to ensure that companies test, individuals test, and corporations are engaged in the prevention action against HIV and TB.
CDC South Africa's relationship really was from 2007, just a little after the launch of PEPFAR, the US President's emergency plan for AIDS relief. And this was at the height of the HIV epidemic when PEPFAR through CDC decided to fund JAPIGO to provide the much needed services of counseling and testing in South Africa. 2007 doesn't sound like it's that far back, but if you think of 2007 and HIV testing then, it was not common. Even now, one of the biggest challenges of counseling and testing is providing it outside of health facilities.
When we started in 2007, the political environment did not allow for workplace testing or even knowing your status, so there was a lot of stigma around testing. We found that Siyazi should be best, especially in the highly populated province like Gauteng.
The project started off very differently from how it is now. The first sort of areas that they went into was the trucking areas, where they were going to truck stops and looking at prostitution and training prostitutes as peer educators, testing people and getting the hard-to-reach places. Well, we started realizing there were other areas, as we've evolved some more, that needed attention. And these were places where there was no formal places where people could go. And so we started going into taxi ranks and even into malls.
So providing HIV counseling and testing outside of health facilities was clearly not common. Worse still, in a workplace setting.
We started going into corporates, and we started making corporate friends in the second and third years.
Men are a rare species, they don't go to clinics. So let's catch them in their pathways, which is workplaces. When a man comes in for VCT, it's an opportunity to do all other screening for health. Your diabetes, your cholesterol, your TB, your STIs, your blood pressure.
Currently, we are targeting especially the people in the workplace, but then we also know that from the statistics that about 67,000 to about 68,000 new infections are occurring in people between the ages of 15 and 49 years. So that means that the people who are at school and the people who are in the workplace are showing a lot of rising infections that have not been slowing down. So the better and the faster and the earlier they know their status, they can allow us to be able to intervene there so that they can have a better life in terms of the goals of the South African Department of Health.
The strategic direction for 2012 has been to develop cooperation between our partners and to help them develop workplace policy. And we've worked with SAFAIDS to do that as well. So we've been working with over 20 companies to develop their HIV/AIDS policy and how we can advocate with the middle and senior management so that we can actually reduce stigma and get HIV and AIDS accepted.
Via our relationship with Siyazi and with Japaigo, we could enter in with very, very good solid foundations with Department of Health. When Japaigo came in, we had just that fresh air. We can move with our HCT testings much better. Each and every person on site gets introduced to HIV in the wellness program once they come into the company, and while they're there, they are serviced. We had a counsellor from Japaigo working with us, which was positive, and he made a huge, huge difference on site. I think that Ford was one of the very few private companies that had our own support group running. When I wanted to start and kick off with it, I couldn't find any information on how to run a support group because nobody simply goes that route. And with the Siyazi Project and our counsellor from Japaigo, we could go that way. Our managers on a yearly basis was trained specifically on the impact of return on investment and how to manage our employees. We are able now to support our employees in such a way that we keep them away from the disciplinary procedures.
What has happened, with and through Siyazi Project has really made a huge dent in many companies who would otherwise have not had the opportunity, to help their employees have longer lives.
South Africa has about 48 million people, and our efforts, the Siyazi efforts, the Solidarity Center efforts, and every other stakeholder who participate in the HIV/AIDS prevention intervention have not reached at least 20 million people. There's a lot of people that still needs to be reached out there. But however, nevertheless, we need to celebrate the achievements of all the interventions up to so far, particularly today of Siyazi. It has been successful because of the types of collaborations that we have with Japaigo Siyazi Project. We've approached Siyazi Project in 2010 because we had created a demand for VCT in companies and we did not have capacity. The Siyazi Project has helped us reach over 104 companies that we have met. I think 60% of those we've done with the Siyazi Project.
Training was a requirement which came to light this year. We're now wanting to develop the capacity of the partners so that they can be sustainable. We had trained peer educators, over 400 of us, and we've exceeded that at this year by 302%. We've also trained shop stewards this year.
We've got 40 trained peer educators, whereby 14 of them are already trained counsellors and 3 of them are pricking counsellors.
I've learned to be a peer educator in a special way because the guys who were here to train us did such a good job that we always wanted to be like them, that we wanted to change careers and be social workers.
We don't have to get people off site because they will consume much time of work. So that's why we test them on site.
And we also started turning them into what we now call wellness champions. Why is this? Because the policy will not just be on HIV/AIDS, but it will be on HIV/AIDS as part of a wellness. So we've started training wellness champions and city parks. We've just started with them, which is City of Johannesburg, are wellness champions. And we've taught at other of our partners as well. We're starting to introduce wellness champions.
The main focus of establishing the relationship with Japaigo was mainly on the HCT. That was done in 2009, 2010, 2011, as well as 2012. Japaigo was an extinguisher to all the mess that we had in city parks when it comes to HIV/AIDS program.
Is it easy to bring in partners within the workplace for testing and wellness as well?
Our policy says that we extend the wellness services to also cover the immediate family members, that's the wife, kids. So we also do test the partner to say, for us to be able to manage your disease, we also need to manage your spouse as well.
The men themselves are not ready to be tested with their partners. And then when it comes to work, in the workplace, some of the companies don't allow outside.
Since 2010 June, we've started couples counseling in our company. Yes, it's very new to our workers. We do have an 80% male workforce, but we also have a lot of couples inside the company that we do test together.
We can test as many people as possible, over 60,000, but high numbers are meaningless unless we link those to care and treatment services. And ladies and gentlemen, I'm happy to say that Japaigo did exactly that. They linked. So not only did they test people through the Siyazi Project, but they also ensured that workers who are tested and know their status were linked to care and treatment and appropriate services.
Japaigo South Africa expanded its focus to work on a continuum of care from prevention through treatment and care. So anywhere on the continuum from pre-pregnancy to up to 5, we can work. So we will address all your MDGs, especially your maternal, newborn and child health, and also HIV.
We also developed programs to transition this program from a purely workplace testing program to a wellness program, and eventually we added counseling and testing, we did cholesterol, we did body mass indexed, as well as referrals that were linking all the employees from the workplaces where we found them to the nearest health facilities.
Integrated comprehensive approach, obviously that links to your primary healthcare engineering process, currently in country. So we work within the frameworks and everything that's happening within country.
With every patient that we test, we screen for TB, STIs, and wellness if it's requested. In the wellness, we're doing blood pressure, overweight, cholesterol, diabetes.
We have a goal to reduce HIV incidence by 50% by 2014. And at the same time, under Outcome 3, we need to conduct 500,000 medical male circumcisions, which are part of the prevention package, as well as make sure that at least over 10 million people and counting should know their status. Because once people know their status, we use that as an entry point for them to access the basic package of services. For the positives one, they are linked to HIV care and treatment and support. And then for the negative ones, we emphasize behavior change. And we also ensure that we give them better prevention methods, for example, your medical male circumcision, which is a very key strategic area that the government is pursuing.
VMMC is the next project that the minister is really pushing, and HCT goes with VMMC. You cannot separate the two.
HCT goes hand in hand with voluntary medical male circumcision. And I think as Chief of Party, without having to blow my trumpet for the voluntary medical male circumcision, we have counseled and tested over 2,000 men and also managed to do circumcisions on them in Mpumalanga.
They've also worked not just with their partners, but they've collaborated closely and working hand in hand with district and provincial health services.
We've always been teamed up with the Department of Health because everything that we do at Japaigo and at Siyazi is in line with what our minister wants to attain.
And currently we are responding to the medium-term strategic framework for South Africa, and this is from 2009 to 2014.
5 years, we've been very, very successful, and we have met or tested over 60,000 South Africans.
This is part of the 10 million so far reported by South Africa in the last 5 years. Almost 53% of them are men, and we hope that these are the men that are going to be knowing their status. These are men who are going to be linked up to care in terms of the negative ones going for medical male circumcision, so that they can prevent and know that they're saving their lives and also try to condomize as well.
60,000 have also been screened for TB and for STIs. We have exceeded what was required of us by CDC by over 160%.
I commend you and your leadership and commitments to improve the lives of South Africans of the affected and infected with HIV.
On behalf of management at City Parks, it's a certificate of acknowledgement awarded to Japaigo for your participation in the JCP Annual Wellness Day on the 30th of November 2011.
People did not believe that you can go to a stadium and have people tested. And we called on Siyazi, and they did it for us. We can attest that it works.
Solid foundations have been laid by Siyazi. And I would like to add that perhaps through Siyazi, we need to pay attention to the signposts on the way that they have laid.
Our institutions of higher learning should be drawn into this process in terms of the evidence. You have many students at our universities and the health science faculties doing diploma certificates, masters, doctorates. Now, that research must be focused on the benefit of the community.
Of course, without the community, there's nothing you can do because the community is the core driver of change. We can do all our fancy programming, but if you don't involve them, nothing will happen.
And so maybe there should be a discussion perhaps between the structures and the deans of the Faculty of Health Sciences at our medical schools. Begin to say when students do research in the health sector, these are the areas they must go and research so that structures like in the room can draw on university. Look, I need 2 researchers. Is there a master student to come and do relevant research that can answer us questions and from the workplace, and thereby it becomes relevant research, evidence-based.
I think Tato said it very well that all of us must strive towards an AIDS-free generation. And that for us to do so, we have to pay attention to the signposts that have been placed by Siyazi in terms of how we can do it and how we can get there.
This project now must become a program, and where are we going in the future? We've built their sustainability of partners. They're trained. They've also got their own counselors now who can prick and test at these institutions.
Now they know their status because of Japaigo. They were referred, and then the CD4 counts and everything. They got the treatment because of the counseling and testing that we offered on site.
For me, Siyazi is like my baby, or it's my home.
We're very excited about this project because it opened new opportunities for us, especially in our country. And we further hope that out of this discussion today, with the funders being available, we can structure a new program to take forward the work that was done.
In the past 5 years, CDC and Siyazi have really worked closely on specifically counseling and testing, HIV counseling and testing. But in the future, the plan is to really go towards a more comprehensive program where we including HIV counseling and testing, other prevention programs, including medical male circumcision, linkages to care and treatment.
The interesting part from the relationship that has been established so far is where are we going with what we have achieved so far. Yes, we've got our people knowing the status. The interesting part will be JPEGO helping us now to manage the condition, because we do have people who have disclosed their status, people who are willing to get help.
People will be queuing to get tested because of the counseling. So to me, that was one of the major successes of the project.
Many difference, the special tax rank, churches, with the rich that we go, we feel that Siyazi make a big impact to the people.
Projects are started, they come to an end, but interventions must continue. That for me is sustainability.
To me, Japaigo is not going anywhere. Siyazi, in particular, is not going anywhere. It's up to us as partners. It's up to us. This private-public partnership, it is up to us to see to it that this partnership continues.
Companies are saying, I'm talking about the partnership between companies and the union in the workplace to say, together in one voice, they're saying, we are worried if you guys are closing shop, because we were benefiting and our programs were starting to make sense for us and for the workplace. If Kathy and the Siyazi Project is closing down, where would we be as Solidarity Center?
With Siyazi, I've gained so much. I have gained so much. Even working in the field, it was great. You meet people and you learn to appreciate your life. You learn to appreciate your health.
With the teams working with people, we're seeing we're changing the whole attitude towards HIV. And that has been very exciting to me. The stigma seems to have been going down, and I was amazed how many of these projects are now really getting going, looking at integrating HIV into wellness, which is the next step forward.
I would like to thank Japaigo because it inspires me, because it's trying its best to make sure that we become HIV-free generation.
I don't believe Siyazi Project will come to an end. I think it's going to become a program, and I believe it will be making an impression in the way forward.
Siyazi helped many in South Africa. So I'm just wondering, are we still going to go on, or are we leaving the remaining millions that are not yet tested?
Boost your confidence, knowing your status, it gives you the morality to live.
Gostei nesta data de hoje de fazer deste, gostei por estar nice, ainda nada do mal que eu tenho no meu corpo. Agradeço nesta data de hoje.
Please guys, go to test and know your status, because if you know your status, you can be free.